And good Tuesday afternoon to everyone. TJ Alds, I-45 now in Galveston now, along with Dr. Philip Keiser, the CEO of the Galveston County Health District, joining us here today. And he's also our local health authority. Dr. Keiser, took some time off for spring break. Glad to have you back on with us here today. Did you get to take some time yourself to take some time off during spring break? Or is it?
No, we had
work, what it?
Yeah, we had a great time. We actually went to the Galapagos Islands and we're on a small cruise for a week, and terrible internet access, so I couldn't work, even though I was tempted to. And it was a great break. We had a great
break. I got to talk to you about that trip kind of as a separate thing. Some friends of mine just got back from the Galapagos, and their photos from that trip were just wonderful. And a great trip. Well, we're glad to have you back. Is there any COVID in the Galapagos? Do you know?
Surprisingly, no, but the way they lock it up tight. I mean, we arrived in Ecuador on a Thursday night. We were immediately COVID tested. And then the next day we got another COVID test because we had to have one within 24 hours of actually flying to the Galapagos. And the time period was like 25 hours. So they made us get us two right in a row. And then as soon as we got back into Quito, they after the cruise, they tested us again. So they're very tight.
Yeah, I wonder though too is that before we get into our regular discussion is that going to be something that we may have to get used to in the long run for travel? Yeah. Is a testing regimen versus mask and vaccination regimen is just a testing regimen.
I wouldn't be surprised. That's the way all the cruise lines are going now. So we didn't have to wear a mask on the cruise, and the cruises that are cruising out of Galveston now don't require masking, but they do require vaccination and testing. And I got to tell you, their numbers are great. They still report everything to us, even though it's voluntary. And we see, maybe one crew member per cruise out of 4,000 or 5,000 people. So, that's outstanding results. So
it's mainly crew members and not passengers then.
It's crew members that come up positive more often than passengers. That's correct. But it's the sort of thing where they're doing antigen testing, and when you have low prevalence, my bet is that random one, that's probably a false positive. So I think cruising is incredibly safe at this point.
Good, because we're about to go on one. So I'm glad you told me that. I'm supposed to always ask that question when my wife asks that. So let's get into it's been a while. We're catching up on a lot of stuff now. But this was a hot topic over the weekend. It's the new, I call it the subvariant of Omicron here. Can you talk about that? Because in what's the effect? Because we are seeing more and more based on the test of it starting to become more prevalent. What we're seeing here in our area.
Yeah. So the Omicron variant has a designation of BA1, and then the subvariant that we're seeing is BA2. That means there's only one amino acid, one little change in it. But it does convey significant effects in terms of its infectivity. It's estimated to be 1.3 to 1.8 times more infectious, which means that it can spread to a lot of other people. So far, it does not seem to cause more disease, at least in vaccinated individuals. And we're following it here in Galveston, and we're seeing the numbers go up. We had, probably 4 weeks ago, right around Mardi Gras time, about 10% of our isolates were BA2, and just this week, 23% of our isolates were BA2. So we're starting to see it creep up like that. And and based on our experience with Delta, we knew Delta was in our community in April, and it wasn't until June that we saw a big surge with it. So at some point when we're getting over 50-60% of them being BA1, we might see a bump. We just don't know.
We'll put that in a little bit of perspective here as we bring up the Galveston County Health District dashboard. And again, this for our Harris County viewers, we only focus on the Galveston County with this because that's the bigger part of our viewership. But it's the active number of cases that's the interesting number to me, 844.
Yeah.
And I don't think we've seen it that low in a long time.
A long time. Right. Long time. And then when you look at the number of new cases we're getting each day, it's, it's a handful. It's one, it's two. Over the weekend, we didn't report. Right. And so usually come in on Monday, what happens is during the surge, Monday, would be our biggest day because we'd have Friday and Saturday and Sunday. So Friday, Saturday and Sunday had 17 cases. between
Totally.
3 days,
Yeah.
almost nothing. The other thing I look at very carefully is the schools, and schools really act like the canary in the coal mine. When we start seeing cases rise in schools, then we start to see cases rise everywhere else. And we've had multiple days with 0 cases from schools, 1 case from school. So we really are at historically low levels for COVID overall since this whole thing began. So I'm feeling pretty good right now about where we are.
And when we talk about that case, let me just kind of put it in perspective here. 844. But one of the things is that could that number be? And I'm not trying to shake this. Oh, that's not accurate. But could it? How many people? How much of that is? Are we seeing testing drop down at the same time here?
Sure.
And because that would have some effect here, but it also I would think, as you said, you look at schools which are still checking up on folks. You're not seeing hospitalizations go up, the visits to doctors and stuff. So this is. Would you say that this 844 is probably pretty accurate?
Yeah, I think so.
Or that it's maybe skewed a little bit because there's not as much testing right now.
Well, no, I think it's pretty accurate, and I think that we always have to suffer with this thing that we don't capture everybody, right? And we don't have a representative sample. We just get reports of who decides to get tested. Now, people decide to get tested for a lot of reasons. Sometimes people get tested because they're feeling sick. Sometimes people get tested because they know someone has had COVID. Sometimes it's because we, the health department, call them up and say, hey, you were in contact with somebody that was positive. Sometimes they get tested because they're just nervous and they want to get tested. But, people get tested for a lot of reasons. So that's why we look at a variety of parameters. We don't just look at the numbers of positives. We look at the numbers of tests. We look at the percent positive. We look at various places where we're getting tests from, whether they be a PCR test or an antigen test. We look at whether they're coming from schools. We look at what's happening in cruise ships. We look at number of hospitalizations. We now are starting to track number of new admits every day. And the reason why we do that is because that's what the CDC dashboard is using as their main indicator. And so when all of those numbers are consistent, then I think we feel pretty good. When I feel nervous about it is when I get inconsistent results, where one's going up, the other's going down. And the question is, what's really going on here? That makes me feel uncomfortable. But right now, all of the indicators are all going in the same direction, which is we have very, very little COVID in our community.
And which is great news. So this goes to something that gets asked by our viewers all the time. Are we done with COVID?
Yeah, I hope so, but I don't think so. I would love to be just done with it. I have this fantasy that we go for like 3 weeks without a COVID case, and then we hold a big press conference and say, COVID's over. It's official. But I don't think that's going to happen. I
we'll
think
see how that goes.
It's not. It's right.
What's going to happen right after that press conference.
Oh yeah. Some people are going to call me up and scream at me. But I don't think that's going to happen. What I think is going to happen is we're going to continue to see cases. We're going to continue to see. I don't want to necessarily call them surges, but bumps in the numbers. Whether they get so high as they start affecting what we do, we're going to have to wait and see about that. I don't know. But I would be shocked if it just disappeared completely.
But are we at a level now that we can, with some confidence, say we're in a level where this can be managed better now?
Absolutely.
Knowing what we know,
absolutely,
knowing what's available out there, what's coming on the market for treatment and therapies and the like.
So we know that about 70% of the people have had a vaccine. We know that another 10 or 15% more of the population has actually had COVID. So you put that together, that gives you about 85%. We know that when people are getting antibody tests, about 85% of them are coming back positive. So meaning that they have protection. So that means it's a very small number of our community that has no protection. And those are the ones that are the greatest risk. And those are the ones that get really sick. And those are the ones that fill up the hospitals. So when you look at it from that point of view, even if we have Omicron coming, or Omicron 2, and the BA2 variant coming, hopefully enough people are protected that it's not going to cause huge surges and it's not going to cause the hospitals to be overrun. What we're seeing happening in China and in Korea, keep in mind that they completely shut down their communities, okay? And then they gave people a vaccine, which was not that effective. The Sinovac vaccine is not as effective as the DNA vaccines that we have, or sorry, the RNA vaccines that we have. And then there was a lot of vaccine hesitancy. Over 50% of the people over 65 are still unvaccinated. So now that you have a variant which may not cause as much disease, such as the BA2, but nobody's immune, it's running rampant through that community. And the numbers are through the roof. And the hospital systems are being affected because even though it's a smaller percentage of people getting sick, say, than with the Alpha variant or the Delta variant, it's still so many that they're having a hard time keeping up with it.
And we should point out if anyone joined us in there late, well, Dr. Keiser was talking when he says, that the hospitalizations represent. He is talking about in
Hong Kong,
Korea
and China. Yep,
We're
not the United States.
Right.
We're in a good spot. We're in the best spot we've been, and not only are we in a good spot because of the baseline immunity, we know how to manage COVID better when people get in the hospital. We have therapeutics that we can give people, whether they be oral medication or whether they be antibodies. We've got plenty of all of them, so there's no reason why people can't be treated as an outpatient and avoid hospitalization. So we're just in the best position we've been in since this has started.
And in fact, we're looking at the numbers now. There are a total of 11 Galveston County residents who are in the hospital now with being treated for COVID-19. Yeah. 7 of those are between the ages of 51 and 80. Right. And then 2 of those over 81, and then 2 younger than 10. Yeah, that hovered at 1 for a while in there, but that's the numbers we have of current hospitalizations of Galveston County residents coming in. You said the treatments are better, therapeutics are better, and along the lines along that. But one of the things that, and I was glad you're one of the first in the medical field that admitted publicly to say, listen, if you have vaccinations and you've had COVID, you are better protected than you were if you had not been before. In fact, we had 2 of our viewers pointing out that you can get COVID multiple times, no sense.
Right.
I'm not sure what Gabe is saying. What makes no sense? Whether you can get COVID a couple of times, or just how people react to it, which I think is more knowing him than yet. But because Dr. Anthony Fauci, the chief medical advisor to the president over the weekend, started somewhat of a surge. Not surge. Let me take that back. A stir when he was on with George Stephanopoulos and said, well, we may have to look in some areas of putting restrictions back in. That set off a firestorm with particularly, the anti-vaccine crowds and some conservative pundits saying Fauci's trying to shut us down again. I didn't hear that so much is that when he was talking, because I don't know what his definition of restrictions were of coming into place. But given how many folks are just tired of being told what to do, when to do it, those type of things. Do you think we're just at a point now we have to treat this like we do with flu, like we do with others, to say, listen, just do us a favor. We're going to do a publicity campaign. Wash your hands, keep a distance as you can, wear a mask if you're comfortable. Those type of things. And that's just going to have to be the message from this point forward.
No, I think that is the message, and that's our plan. When these things happen, we're going to say, okay, right now, people are asking me, do I need to wear a mask? And I'm going, no. And I see people, they're coming into the building. Oh, I have to wear this. I go, no, you don't. It's okay. We're in a good spot. And we even sat down with our clinic staff and said, okay, these are the new rules. While you're in the clinic area and seeing patients, you do need to wear a mask, but you don't need to wear a mask when you're in the break rooms and when you're in other areas. And it's taking people time to process this, because we got, I'm never going to wear a mask group, and we got I'm always going to wear a mask group.
Right.
And what we really need to do is we need to get both of those groups moving more toward the middle, where, okay, it's getting bad, it's time to wear my mask, right? Versus, okay, now it's getting better, so I don't need to wear a mask. Or, now would really be a good time for me to get that booster that I've been putting off, right? Because we're seeing the numbers come up. And so that's the way we're going to be approaching it. And, we're going to be, telling people, oh, the numbers of Omicron are going up. So, if you haven't got your booster, get your booster. Come on in. We got plenty. Come and get it. Bring a friend. And so I think what we're going to see is we're going to see shifting public health messages, much like weather reports. This morning, right? It was all about the weather. It was, stay home if you can, stay off the roads, watch out for flooding. We're going to, and what happens, there are people that stay home and watch out for flooding, and there are people that go, I got a big truck, I can go through this, right? And that's just the way it's going to be in the future. The other thing that you have to keep in mind is that, there's still influenza out there. There's a what's called avian flu that's slowly working its way through the country. Haven't had it here yet, but it's coming. And there's going to be a time that we may be telling people, hey, this is really bad flu out there. It'd be a good idea for you to wear a mask, particularly if you're older, particularly if you're susceptible to having something bad happen to you with flu.
Speaking of flu, since you mentioned that, I wanted to ask this because is there any tracking of, because flu vaccinations? I met someone the other day that said, you know what? I totally forgot to get my flu vaccine.
Yeah.
It said, I was so worried about COVID, I didn't get my flu vaccine.
The answer is no.
Yeah.
So
that's because that's not tracked as we are doing with COVID, is it?
Well, they should be. They're supposed to be reported and put in MTRAC, the same system, and your healthcare provider should be tracking that. But it's just something that we have not paid a lot of attention to. Same with the vaccines against pneumonia. The last thing you want to do is get flu and then get a bacterial pneumonia on top of it. That could kill you. Some of the things we've learned from COVID is that we don't do a good job at tracking these things. We don't do a good job with what we call medical informatics, and we need to do better. And we need to apply the lessons that we've learned in the technology we've applied to COVID to a lot of other disease entities.
I wonder though on that point, because I as many times we've had this discussion, is numbers can be certain thing to some people and certain things to other.
Yeah,
a medical professional can look at numbers and say, well, that's concerning. And everyone hears that, and then then not everyone, but folks will hear that and go, "Oh no, the medical professionals are concerned."
Right? Yeah.
There's levels of concern, are there not?
That's absolutely right.
I think it's one of those. I know you've talked people off the ledge with this before, so this is concerning. Well, yeah, but in reality, it's only concerning as we look at a trend, not a concern. We're going to go into some drastic measures, right? I mean, that's what you're really. That's right. Looking at that case. So maybe how the message is delivered needs to be, and you and I have talked about this a lot, how that message is delivered needs to be improved, probably more than anything else.
Absolutely. Absolutely. And one of the other thing is, I think, as we move forward, is we have to remind ourselves, as one of the core values of public health is you do the least intrusive intervention for the shortest period of time. And why is that? Because you lose people. And, people like to say, well, Texans, they're independent and they don't want to do things. Well, this isn't Texas. This is all over the world.
Yeah.
We've seen people getting upset with their governments because some of these things have just lasted for far too long and they've been far too rigid. And so, as we move forward, this is something we got to figure out. And I'm not sure we're there yet, but we got to figure out how to get that, ebb and flow. When is it? Okay, guys, it's time to do something because it's really bad. And okay, now it's time to go back and just live your lives the way you want to.
Gotcha. Speaking of, shots, boosters, and the like, last week or 2 weeks ago, actually, the Pfizer CEO said a fourth shot is needed. And I'm going to ask it, as most of our viewers are, is that medically proven, or is it just the company seeking more funds?
It's probably a little bit of both.
Yeah.
So here's what we know about fourth shot. All right. So we know that the vaccines wane in terms of the antibodies that they make over time. And that, just two shots, 6 months later, most adults don't have enough antibodies to give them as good protection as they had when they first got those shots. All right. And so that's why the third shot was recommended. Now, with the fourth shot, the data, a lot of it comes from Israel, where they saw people who were over 65 who, without that fourth shot, were much more likely to get COVID. Although it still seemed to protect against hospitalization and still seemed to protect people from dying. Although some, they still had some people dying. Saw the same thing in England and Great Britain, and so they've recommended 4 shots. In England, it's over 60. In Israel, it's over 65. But there was a study that just came out that says the benefit of getting that 4th shot is not the same as getting the benefit of the 3rd shot. So, it doesn't, if the 3rd shot gets you up to here, the 4th shot may get you up to here. And so there are diminishing returns. So, is the science there? Sure. Absolutely. And would I recommend people getting a fourth shot? We already provide people with 4 shots if they're immunosuppressed or have some reason to get it. But if I were the president of Pfizer, would I see this as a business opportunity? Sure. Right.
Yeah.
So, yeah.
And
Right.
I think there's a lot of folks that saw that and said, wait a second. Sandra Sutton asked this question, if eligible, and I don't think there's actually an eligibility on that second booster right now. Is there? Or technically there is, I guess.
Technically, you have to be people that are if you're over 65 or if you have some immune suppression. It's if you're and in general, we say people that that have cancer, that have other types of things. If you're not sure, you can talk to your doctor. If you want to come down to the health department, we don't question people. If you just say you're here for your 4th shot, generally we want to see people, at least 4 months from their last shot, between that 4 and 6 month period of time since their last shot. But you can come to the health department, to our vaccine clinic, and we'll give it to you.
And you can get it there, but you can also go into any Walgreens, Walmart,
right. That most places will do it. Some places they're a little more sticklers. We feel like that it's not our job to sit there and give people the 3rd degree or play their doctors. Our job is to administer the shot. So if someone shows up and said that they want or need that 4th shot, we'll go ahead and give it to them.
And you can go and do that. And if you go to the gchd.org,
right
there, Sandra, that's the Galveston County Health District's website. I'm trying to pull it up right here so you can see, because there's actually, when you look on the home screen, it actually says, hey, do you want to come on in and get a booster with your vaccine or anything like that? It actually, you can go on there. Although I think you can probably walk in most days, but you can go in there and schedule your appointment to do that and to take place of that. And we had a question from another viewer. This George Pappas is asking, and he's got it misspelled here. I don't think it's called Novavax Vax. It's a Nuva Oxovid or something like that. It's NUVAXOVID actually, Vax. That's out there, but there is some developments of some other. We're getting what we've known as the Pfizer or Moderna vaccines, getting their brand names now. But there's others that are developing. They're out there as well. Novavax stock is more of a European vaccine than it is. I'm pulling it up now as we talked about it. And there was some talk about it here too, and there. So that's just so that folks understand. It's more prevalent in Europe than it is here in the U.S. I don't think it's one of those that's available in the U.S. right now. It's not been approved by the FDA here.
Yeah, and that's one where I think they think they found the formula for all the coronaviruses, and so it's being touted. It's being promoted as a sort of a pan coronavirus vaccine, which, if it holds up, would be a really, really good thing, because that way you can get vaccinated once and not have to worry about any coronaviruses ever again.
And again, we're taking a look at, as I said, it's more European right now. It's going through trials. Not trials. It's going to be presented in the U.S., but it has not been yet. There's no date line. It's in the European Commission, but not in the U.S. market right now. So just so we can give update for our viewers on that question there. Months since Mardi Gras, we talked about our numbers: 844 total positive cases.
Yeah,
obviously Mardi Gras is a regional event.
Yeah.
And so that affects Houston. And did we see any bump?
Nah.
I don't want to call surge, but
no.
Increase from that.
No, it just kept going down. So I mean, before Mardi Gras, I said that Mardi Gras was going to be our stress test, and I don't know how many hundred thousands of people came for Mardi Gras, but that was a real opportunity to see cases rise. And so the first year of COVID, we didn't have COVID in our community when we had Mardi Gras in 2020, but they had it in New Orleans. And after that, New Orleans went crazy with COVID. They had huge spikes. And so I was very curious to see what was going to happen with Mardi Gras, and had been referring to it as a stress test. And I think we've passed that. And so now we're coming out of spring break. And, we've had a lot of people down on the island for spring break, again, regional event, but still people are in restaurants, people are in hotel rooms, people are moving around, and we're not seeing increases yet at this point, either here or in Houston or even in the surrounding counties. The numbers continue to drop consistently across the region.
Which is good news as well too. And it goes to kind of the combination of everything, the vaccines, people kind of aware of certain protocols as well to take place going along. I jokingly, someone had told us during Mardi Gras, they were in the umbrella brigade. They said the umbrella was protecting them.
Well, maybe it was from all the COVID floating down from the balcony.
And you were the Grand Marshal of the Gambrinus parade. You weren't counting every individual to see how many people had come to the island as you and your wife were cruising along.
No, I was just trying to get a good shot at them,
with your beats. Of course, now we talk about this, and now the focus hopefully will shift to things of what's being done to study long-term effects of COVID-19.
Yep.
2 years later, because that is an issue that I would call it the sleeping giant issue. More and more as I look into this, there are everything, I talk about the brain fog effects that I have from it, but there are other health issues that have come from that. In some cases, a combo of things where it's a COVID-related illness or an effect, but also too, because during the pandemic early stages, folks weren't seeing their doctors for checkup on cardiac and cancer and the like, that we're seeing this kind of double whammy coming down the road. Are we about to see, how much of being a surge, and using it in a positive term here, of really treating folks on the long-term effects?
Yeah, I think the first thing we're going to see is a whole host of studies trying to understand what the long-term effects are. And the reason why I say that is, someone comes in and they say, I had COVID 6 months ago and I still feel bad. You can say, okay, well, you've got some long-term effect of COVID, but what is it really, and how is it negatively affecting you? And then how do we design therapies to try and help you? That's the part where we don't know at this point. And so we're seeing a whole host of studies that are looking at this. So, UTMB has a COVID post-COVID clinic, which is run by pulmonologists, and they have neurologists there. We're actually working with an investigator at UTMB who, studies. Basically, he works in Africa, studies the long-term effects and the social effects of HIV on families and communities. And so we're going to be working with him and helping send out surveys to people that have had COVID. And they'll get an email, say, if you'd like to participate in the study, please click this thing. And they're going to ask them a lot of things about their lives. And one of the points that he makes is that, exactly as you said, that this is not just one thing, it's a whole cascade of things. People get depressed, people can't do things physically, it affects their well-being, it affects them going to get medical care, it affects their relationships with their families and their kids, sometimes potentially can lead to abuse. And then he made this comment, which I thought was really insightful. He goes, it happens with all the other chronic diseases, why shouldn't it happen with COVID? So I think we are going to see a lot of that. The state of Texas has funded a pandemic response institute, which is the whole point of it is, and it's going to be up at UT Houston. The whole point of it is to be able to develop responses to other pandemics and biologic threats as they come. But within that legislature is a line that they have to study long-term COVID. And so, I think we're going to see a lot of this. We're going to see things where, it's not just shortness of breath. It's not just that I can't think, okay. It's really figuring out what that complex is of all of those things and how they work together. And there'll be more as time goes on.
And we should point out UTMB Health has its own long-term
that's right.
One on over there.
That's right.
We affectionately called the Long Haulers program early on.
Yeah.
I think it's got an actual real official name that we're going to be touching on that here pretty soon as well. What I like about this too is we have less to talk about that, and maybe we're going to treat this like you were saying earlier of when we have a bump, do different things. Our show's right at 30 minutes. We're normally going to an hour, which is pretty good about that. So we get to wrap things up a little bit earlier. But before we go anywhere on that, I wanted to congratulate Amy Cawthorn She's the new chief operating officer of Coastal Health and Wellness there. So that was announced some time back, but our first chance on this show to do that. We've gotten to know Amy pretty good there of the time. Talk about her and her role now at Coastal Health and Wellness, because it's independent, but it still works very much in conjunction with the health district.
Yeah, absolutely. And Amy actually changed careers. She was a project manager in the construction business, and then went to nursing school and worked in emergency rooms. And that was a little tough on her family. So she decided to go into public health, and she first started working in the TB program, and then just took more and more responsibility over the public health nurses. And then when COVID hit, man, she was just everywhere, and she was instrumental in all the testing that we did, and the vaccine programs, and really showed a lot of leadership. And then she was interested in the COO job, and we thought, well, when that opening came, that we couldn't think of anybody better. And so, Amy is kind and compassionate and smart and tough when she needs to be, and but really is really good at getting things done and motivating people. And we've got big plans for Coastal Health and Wellness. We just like COVID unmasked a lot of things, and unmasked a lot of need for people who may not have health insurance or be underinsured to get health care. So, we're planning on expanding. We're looking at hiring new doctors. We're looking at bringing in new programs and being able to serve our community, and to work closely with the health department, so that as the health department becomes, as our public health efforts get more outside, and we start addressing chronic diseases like hypertension and diabetes, when people say, well, yeah, I've got this, but I don't have a place to go. Well, we got a place to go for you, and Amy's the one to help take care of you.
When when she needs to get tough on you, she does. I will say that. I jokingly told her one time, I said, you can tell you came from the construction field before going into nursing on the way as well. And I was saying that affectionately, because I've gotten to a lot of folks who don't. She's not been the kind of the public face of all this. You have been all this time, but those of us who have been around behind the scenes and working at different events and doing different things.
That's right.
She's been there every single time. And I could just say a joy to work with, and knowledgeable, and is a real leader. I will tell you that. Tells folks where they need to go, and does it with a nice smile and the like. But again, Coastal Health and Wellness, if you go to, it's coastalhw.org if you're interested. Again, if you know somebody who doesn't have insurance or is underinsured, this is where you can go to get health care. And it's the main spot. And the nice thing is, you don't necessarily have to be a Galveston County resident to do it.
That's right.
For it as well, because it's federally funded along the way. So congratulations to Amy on getting that chief operating officer's position. So, and again, just as we'll do along the way, we'll still have a show next week, but we may, cut this back to once a month, once every other week on COVID subjects. We do want to continue it on because we've got summertime coming up. I was thinking, one of the first ever interviews I did with you was, after the hurricanes we had here, and I'm watching what's happening in Central and North Texas after the severe weather. And one of the things I would think you would assure folks is that as we get ready for hurricane season, not too distant future, is that folks need to make sure they have a healthcare disaster plan in place for themselves,
right. Have a little box that you can put all your medicines in, that you can, if you have any medical devices that you need, you can put them in. And if you have something where you can put a copy of your medical history, put that in there. And that way you can walk out. We've seen so many people at shelters after Hurricane Harvey who, they didn't have any medicine. They couldn't tell us what medicine they were taking. And they didn't, they could tell us what was wrong with them, but really couldn't give us a lot more to that. And so we would definitely recommend that, just like you have your passport and your marriage certificates and everything else, have some stuff there for your health as well.
Yeah, smart move on that. And nowadays too, with the apps, whether you have like your UTMB app or your Walgreens app or something like that, a lot of the info you need, like every time I even in my own doctor's visit, when they say, well, what are you taking for this? And I pull it up on my screen. I say, oh, it's this. because I can never get the names right
Right.
anyway. I'm
Yeah.
going to give them the official name.
Yeah.
And it works out gratefully there. So we'll talk more about that and other healthcare issues as we go. So Dr. Philip Keiser, he's been on with us as he does. And we took a little bit of a break. Glad to have him on here today. We appreciate you as always, Dr. Keiser, and we appreciate everyone watching. We'll be back with y'all next week. Until then, I'm TJ Olds, I-45 now.